Good afternoon. I'm Danielle, a nurse in the senior residency. I wanted to discuss a patient of mine who has been experiencing constipation for the past week. I'm concerned about her condition. What could be the underlying cause, and what steps can we take to alleviate her discomfort? Would it be appropriate to administer a rectal enema?
Good afternoon, Danielle. I'm Fadi, the pharmacist here. Please have a seat in our private consultation area. Before we proceed, could you share the name and age of the patient?
Certainly. Her name is Rose McDonald, and she is 64 years old.
Thank you. Could you provide a bit more detail about her condition?
Of course. Rose has an ileostomy, and her constipation began about a week ago.
I see. Has she experienced any fever?
No, she hasn't had a fever.
What about blood in her stool?
No, there's no blood present.
Any signs of nausea or vomiting?
No, she hasn't reported any nausea or vomiting.
Does she have any abdominal pain?
No, she doesn't seem to be in any pain.
Could you please clarify if the patient is experiencing any abdominal gases?
Yes, she does.
Are there any other medical conditions we should be aware of?
Yes, she has been diagnosed with osteoarthritis, and she started taking Tylenol 3 about 10 days ago.
Have you informed her doctor about her current condition?
Unfortunately, her doctor won't be available for another 2 days.
Understood. Is she taking any other prescription medications?
No, just the Tylenol 3 for her osteoarthritis.
How about any non-prescription medications?
None.
Any herbal or supplement?
She takes vitamin D, 1,000 units daily.
Does she have any known allergies?
No, she doesn't have any allergies.
Does she smoke?
No, she does not smoke.
What about alcohol consumption?
Yes, she has 1 cup of alcohol each night.
Is there any restriction on her diet?
No, her diet is regular.
Thank you for the information. Could you give me a moment to consult my references?
Yes, of course.
Thank you for your patience. After reviewing the relevant information, it seems that the initiation of Tylenol 3 is likely the primary contributor to her constipation, as it contains opioids. While she needs to continue her pain management, it's important to address this issue. Given that Rose has an ileostomy, she should ideally be referred for further evaluation. If she can't see her doctor in the next couple of days, I strongly recommend that she visits the emergency room for a thorough assessment. Also, I advise against using enemas for patients with colostomies or ileostomies. For immediate relief, we should focus on increasing her fluid intake and consider a laxative like sodium docusate, a stool softener. Additionally, it may be beneficial to avoid gas-forming foods, including beer, mushrooms, and carbonated drinks. It's important for her to eat slowly, chew her food well, and avoid using straws or chewing gum. Encouraging fluid intake, fiber-rich foods, and regular exercise will also be helpful.
Thank you for the comprehensive advice.
Would you like to follow up with the patient in 2 to 3 days to monitor her progress on this regimen?
Yes, that sounds like a good plan.
Thank you for including me in this circle of care. Together, we can ensure that Rose receives the best support possible during her treatment.
Absolutely. I appreciate your collaboration in this matter.